So this video that I am going to do here is a demonstration of how it should be, or how a lymphatic massage should be done by a manual lymphatic therapist if a client has a missing lymph node. Just like, for example, if a client has a lymph nodes removal from her axilla or the armpit, and there is a tendency that this client will accumulate fluid or protein rich fluid in her arms, okay, because we are missing that lymph nodes. As you know, our lymph nodes is our filtering system. So excuse my drawing here. I'm not very good in drawing, but I'm gonna try my best. Okay, so we will create a head. Okay, and so we have the neck here. My head is not very straight, so we will have the shoulder. And okay, I'm not very good drawing, guys, so bear with me. Okay, so I'm just going to show the upper body. Okay, and then so this one right here is our normal arms. Okay, and this one right here is our arm that has got affected with fluid retention. I think my arm is a bit big. Okay, so I'm gonna create my thumb here. So be careful. So sorry for my arm. So okay, now this one is quite a big because my client is just developed a lymphedema here. Okay, and that is her waist. Okay, so that's my drawing. Okay, it has the arm here, it's pretty normal, and it's got the arm here. So don't judge my arm. Okay, it's pretty sexy right now. So we have also lymph nodes here, the cubital, and then here it's got the lymph node removal. Okay, so there's a surgery here. We got lymph nodes removal. Now, so let's make some clavicle here too, and let's put some ice in our little guys. Okay, it looks like an alien right now, so I'm sorry. Trying my best, not very good. All right, so here, so this is the another, so this is the right one, and this is the left one. So left one right now swelling, so the lymph nodes here are damaged or it's got taken away. Okay, see, there's a surgery. Okay, this client has mastectomy. Okay, she survived her cancer, so she had a mastectomy. Okay, she got a surgery right here. Lymph nodes got taken away. And then this one right here, the lymph nodes right here is pretty healthy. So these lymph nodes are doing fine. And as you can see, the hands, the arms do not have any swelling. Now, we have problem here. Our arms here swollen. So what we gonna do with this fluid retention? We cannot dump it here. It's because lymph nodes here is, as you can see, it's swelling because the lymph nodes here got taken out. Okay, so what we're gonna do, we're going to clear these lymph nodes, and we also have lymph nodes here in our inguinal. Okay, so we're gonna put the belly button there, and then we have the inguinal here. So we have the, let's see, the inguinal here. Okay, so oops, so we have lots of lymph nodes here. Okay, I should have a green ink. Okay, so we have a lot of lymph node here, here. Okay, so that's our entry. See, triangle. So we have a lot of lymph nodes. So the direction of the fluid when we drain, we cannot dump it here. Okay, as I said, lymph nodes are taken away. Okay, so what we're gonna do then is we're gonna do some clearing here. We're gonna start from, at first, okay, we're gonna do, before we do actually the clearance, we're gonna do the stimulate the nodes here. We do some breathing, 9 to 10 breathing here, deep breathing to stimulate the thoracic duct. And then after that, we are going to clear these nodes here and then clear these nodes here. Okay, this here, because this one right here and this one right here is our door. Okay, so usually the fluid is then gonna go direct there. Okay, direct there, and then there, right? So that's our direction. But then we're gonna start, when we drain, we're going to start close to the nodes because we're clearing it, and then the fluid here can dump there, and then the fluid there can dump. So this one, I will number this one your number 1 stroke. This is your number 2, and then this is your number 3. All right? So clear that one. When you clear first this side close to the nodes, and then the middle, and then this one right here, and then after that you're going to just flush like all the way, right? And then this one's close to the nodes also, so this is gonna be your number 1, and this is gonna be your number 2, and this is gonna be your number 3, right? So you start clearing here close to the nodes, and then here, and then here, and then after that you go boop. Okay, after you clear 1, 2, 3, and then you go like that, right? You just kind of like connect them. So you clear, so we are all clear. Now we're gonna start clearing this fluid. All right, so this fluid, we're just gonna go, we're gonna bypass that one right there. We're gonna bypass that. We're not even gonna drain anything there at all. So we're gonna start proximal, the very top. Okay, so I'm going to stop. Okay, I'm going to start right there, all right there. Actually, there's a swelling here, medial, you know. So before I'm gonna do anything here, I'm going to clear this path right here. I'm going to create a bridge. Okay, so I can go the fluid there. Okay, the fluid there, so I can go the fluid there. So I already cleared that one, and you can see there's a lot of swelling here. But before I do anything in that swelling, I'm going to create a bridge right here. Okay, so this is lateral and this is medial side, right? Before I do anything the medial, I need to do some clearance here, lateral side of the arm, so the fluid from the medial can flow and reroute to the other side. So I'm going to clear that one, so it's clear, and then this fluid here, I'm going to reroute that fluid there. Okay, go medial to lateral, going to reroute the fluid. So I will be using a stationary circle here. So when I clear, I'm going to start the top. Okay, so that's gonna be my 1, that's gonna be my 2, it's gonna be my 3. Okay, so I'm going to dump them all there. Now it's clear there and it's clear there, right? And then after that, I'm going to connect, and then I'll go dump them here. Then after that, I'm going to also stimulate these nodes here. We have the nodes here, you know, that can help, right? But eventually all the fluid will really go all the way here. Okay, so after that, I already did a clearance proximal, and then I'm going to do I'm gonna use a pump technique here. So I'm just gonna use that, and I'm gonna do that. Okay, oh, sorry, my arrow is not very good. You know, I'm not really good. I'm not very good artist here. Okay, so direct all the fluid, medial again, and then go reroute, dump here. Okay, now we did clear. Then as you can see, the client is gonna have some swelling here too. Okay, gonna have some swelling here. So then we're gonna direct all that here. First, we're gonna clear. This is our number 1, number 2, number 3, and then go all the way down here. So we have 2 entry, axilla and inguinal. And this is our direction. First, we're gonna start proximal, and then here, and then flush down here, down here. But again, let's review. First, we're gonna work the cervical lymph nodes, our diaphragmatic breathing. We are going to stimulate the lymph nodes here. I'm going to stimulate the lymph nodes here. And then we clear, clear, clear. Number 1, number 2, number 3. Clear, 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 clear. Number 1, number 2, number 3. And then we're clearing the lateral side of the arm proximal. And then we're also clearing. We're going to go reroute that fluid from medial to lateral. Start proximal. Okay. Do that way. And then we have the cubital here. Don't forget that one. The lymph nodes here that can do a lot of help. Then from the arms, we're going to use the pump technique here, Voder method technique. And then we go flush, connect, go dump there, and dump there. And then you can go back with your cervical node stimulation again. And then you end with 9 breathing. So actually start from the belly button on top, and then the rib cage, and then the iliac crest on top. Go back to belly button. Okay, then you go here, another rib cage on the right, and then here on top of the iliac crest. Go back here and stop belly button. You start in the belly button, stop in the belly button. So actually it's kind of like a letter M. Okay, 9 times. Alright guys, look at my guys has no little mouth, so she's smiling. She just had a lymphatic massage, a really good one. There you go. Oh, you're missing teeth. We're gonna put some teeth. Alright, so, oh, she cannot breathe. She has no hole in her nose. Oh no, you're just looking weird. Anyway, that's how you do your lymphatic massage for the clients that has missing lymph nodes because of the mastectomy surgery. If you have any questions, my name is Chris and I am the lymphatic therapist and owner of Lymph in Motion here in Cedar Park. I am specializing post-op recovery and lymphedema management. See you and see you soon.